Hi, my name is Satish, and my research project was on calculating the individual and population parameter values in the healing of chronic wounds through mixed effects modeling. My research mentor was Dr. Richard Schugart. Chronic wounds do not heal at a predictable rate, causing challenges for medical professionals during treatment. In order to address this issue, a mathematical approach was used to model the biological process of wound healing. There are four biological factors included in this mathematical model: matrix metalloproteinases, or MMP1, tissue inhibitors of metalloproteinases, or TIMP1, the extracellular matrix, or ECM, and fibroblasts. The ECM makes up the lower layer of the dermis. This is where collagen production occurs. ECM itself is a connective tissue made up of collagen. When this connective tissue is damaged, enzymes called MMPs break it down to allow for production of new ECM. This allows fibroblasts to migrate to the damaged tissue. Fibroblasts are the primary mesenchymal cells present in the wound. They produce collagen, which is essential to the connective tissue in the skin. TIMPs are responsible for regulating the activity of MMPs, which in turn regulates the degradation of ECM. It is crucial that MMPs are regulated well since they are integral in the synthesis of ECM. The interactions between MMPs, TIMPs, the ECM, and fibroblasts are crucial to the wound healing process. Thus, the relationships between these factors are studied using the mathematical model. The data used was from a study that measured levels of MMP1 and TIMP1 collected from wound fluid, as well as wound surface area in 16 patients over the course of 12 weeks. Measurements of the levels were taken 6 times in the study period: week 0, 1, 2, 4, 8, and 12. My research is based on studying the complex biological interactions in wound healing using a combination of patient data and mathematical modeling in order to generate parameters that aid in predicting the individual patient healing response. The original mathematical model was formulated using averaged patient data from the study. 4 differential equations are used to model the levels of MMP1 or M, TIMP1 or T, ECM or E, and fibroblasts or F over time. The original equations were rescaled in this work. MMP1 and TIMP1 data was scaled by the average initial concentration. The ECM data was derived from the wound surface area data by subtracting from the largest wound surface area possible and then dividing by the maximum surface area. Fibroblasts and ECM were scaled by the carrying capacity. In total, 12 parameters are included, each correlating to a different biological factor. The parameter Fi represents the initial condition and must be between the range 0 and 1 because it directly correlates with the ECM. This research was conducted using individual patient data. So here are the 4 differential equations used. The MMP1 fibroblast production is modeled by a Hill function of order 3. MMPs are assumed to degrade linearly. In wound healing, TIMPs inhibit MMPs by binding to the enzyme in a 1-to-1 ratio, and this regulatory effect is represented as an inhibition term. And this gives us the first equation here. Our second equation is for TIMPs, which is also modeled by a Hill function of order 3. And it is also assumed fibroblasts will produce TIMPs if MMPs are present. The same inhibition term is used in the MMP equation, is also used here because the binding between the TIMPs and MMPs is generally irreversible. The third equation is for the ECM, and it is represented as a constant rate with a carrying capacity. In addition, ECM degradation from MMPs and the natural decay of ECM is represented as a constant rate. Fibroblasts are included in this model as cells that produce MMPs, TIMP1, and ECM, and that is our fourth equation here. They are represented using logistic growth with carrying capacity, and the cell death rate is also modeled as a constant rate. So mixed effects modeling was utilized to generate parameters for the individual patient data. Mixed effects combines the individual and population parameters for each patient. The population parameter represents an averaged patient response derived from the average data, and it is the same for all patients. The individual parameters represent the individual patient response, and it is based on each patient's data. As such, it is unique for each of the 16 patients. Mixed effects modeling was implemented in Monolix, a modeling software created specifically for that purpose. The stochastic approximation expectation maximization algorithm, or SAEM, is Monolix's implementation of the stochastic algorithm. SAEM is an iterative algorithm that uses Markov chains to estimate population parameters. After the original SAEM estimation, Monolix combines the resulting population parameter estimates with the individual patient data to determine the empirical base estimates, or EBEs. EBEs are the mode of each individual's conditional parameter distribution. Essentially, they're the most likely values for the individual parameter. The data collected from all the patients was inputted into Monolix and run through the SAEM algorithm. From there, it was the EBEs were estimated. So here are the individual parameters from K1 through F5 for all of the 16 patients. Using Monolix's SAEM algorithm and empirical base estimates, all patients were able to be curve fit. Patient 16's MMP1 data had 0 values for both week 0 and week 4. The original patient data was only calculated to 2 decimal points. Thus, it was assumed that the 0 values could be replaced with 0.001 in order to curve fit the data using the mathematical model. For the first time, patients 10 and 13 were also successfully curve fit. In the past, it was due to a lack of data recorded for them in which they were unsuccessful. As such, both patients only had 2 data points for MMP1 and TIMP1 and ECM. Mixed effects modeling using Monolix was able to bypass this issue since population parameters are calculated using data across all patients, from which the individual parameters are then derived using the EBEs. The minimal data was able to be compensated for. The results in Table 2 are the population parameters generated from the SAEM algorithm, from which the individual parameters shown previously were generated. And the results from Table 3 indicate how crucial a parameter is to the overall healing process. Parameters with lower standard deviations are more likely to be important to wound healing, since there is minimal oscillation between individual patients. For example, the parameters K1, K8, and K11 have low standard deviations, so we can predict that these parameters are more critical during the healing process. Through Monolix, all 16 patients were successfully curve fit. Mixed effects modeling was able to circumvent prior issues with modeling patients 10 and 13. And future work will include applying the newly generated parameters to a sensitivity analysis to determine which parameters are the most important in the wound healing process. We will also compare the parameters we have generated using Monolix with old parameters to kind of compare between the 2 methods and see which one is more conducive to mixed effects, to mathematical modeling. Here are works cited, and thank you.